Erectile dysfunction, ED, is a condition characterized by the inability to achieve or maintain an erection firm enough for sexual intercourse. It can be a persistent or occasional problem and can occur at any age, although it's more common in older men. ED can have physical or psychological causes or a combination of both. Physical causes may include issues with blood flow to the penis, nerve damage, hormonal imbalances, or side effects of certain medications. Psychological factors such as stress, anxiety, depression, or relationship problems can also contribute to ED. Treatment options vary depending on the underlying cause and may include medications, lifestyle changes, therapy, or medical procedures. It's essential for individuals experiencing ED to consult with a healthcare professional for proper diagnosis and treatment. Erectile dysfunction, ED, is relatively common, especially among older men, but it can affect men of all ages. The prevalence of ED increases with age, with estimates suggesting that around 40% of men at age 40 experience some degree of erectile dysfunction, and this percentage increases with each decade of life. However, it's important to note that ED can also affect younger men due to various factors such as stress, anxiety, lifestyle choices, or underlying health conditions. Overall, the prevalence of ED varies depending on the population studied, the definition used for ED, and other factors. However, it's widely recognized as a significant health concern that can have a substantial impact on quality of life and overall well-being. Erectile dysfunction, ED, can be caused by physical and psychological factors, and often a combination of both. Physical causes include poor blood flow, nerve damage, hormonal imbalances, certain medications, and lifestyle factors such as smoking, alcohol consumption, drug abuse, and obesity. Psychological causes include stress, anxiety, depression, and low self-esteem. Other causes may include underlying health conditions, psychological trauma, and relationship problems. It is important for individuals experiencing ED to seek help from a healthcare professional to identify the underlying cause and determine the most suitable treatment. This may involve addressing medical conditions, making lifestyle changes, seeking therapy for psychological issues, or addressing relationship problems. There are various potential causes of erectile dysfunction, and a healthcare professional can help determine the most effective course of action to address the specific factors contributing to an individual's ED. Several factors can increase the likelihood of developing erectile dysfunction, ED. While ED can affect men of all ages, certain groups may have a higher risk. 1. Age. ED becomes more prevalent as men get older. Aging often leads to changes in sexual function, including decreased testosterone levels, increased risk of health conditions affecting blood flow, and potential psychological factors such as stress or relationship issues. 2. Medical conditions. Individuals with certain medical conditions are at higher risk of developing ED. These conditions include cardiovascular diseases such as heart disease, atherosclerosis, and high blood pressure. Diabetes, which can damage nerves and blood vessels involved in erections. Neurological disorders like multiple sclerosis or Parkinson's disease. Hormonal imbalances, including low testosterone levels. Obesity, which is linked to various health problems that can contribute to ED. Chronic kidney disease. Peyronie's disease, which involves the development of scar tissue in the penis. 3. Lifestyle factors. Certain lifestyle choices can increase the risk of ED, including smoking tobacco, which can damage blood vessels and reduce blood flow to the penis, excessive alcohol consumption, which can impair sexual function and decrease libido, illicit drug use, such as cocaine or methamphetamine, which can contribute to ED, sedentary lifestyle and lack of exercise, which can lead to obesity and cardiovascular problems. 4. Psychological factors. Mental health issues like stress, anxiety, depression, or relationship problems can contribute to ED. Performance anxiety, in particular, can be a significant factor in younger men experiencing occasional ED. 5. Medications. Certain medications, including antidepressants, antihypertensives, antihistamines, and drugs for prostate conditions or cancer, can have side effects that contribute to ED. 6. History of pelvic surgery or injury. Surgical procedures or injuries to the pelvic area can damage nerves and blood vessels involved in erections, increasing the risk of ED. While these factors can increase the likelihood of developing ED, It's essential to remember that ED is a treatable condition, and individuals experiencing it should seek medical advice for proper diagnosis and treatment. Erectile dysfunction, ED, can have various complications that extend beyond the inability to achieve or maintain an erection. Some of these complications include 1. Relationship problems. ED can strain relationships and lead to communication issues, decreased intimacy, and emotional distance between partners. Frustration, guilt, and embarrassment may also arise, affecting overall relationship satisfaction. 2. Decreased sexual satisfaction. ED can lead to decreased sexual satisfaction for both partners, as sexual activity may become less frequent or more challenging. This can impact overall quality of life and emotional well-being. 3. Low self-esteem and confidence. Men experiencing ED may feel inadequate or less masculine, leading to lowered self-esteem and confidence. This can affect various aspects of life, including work, social interactions, and overall mental health. 4. Depression and anxiety. ED can contribute to psychological issues such as depression, anxiety, and stress. Performance anxiety in particular may worsen ED, creating a cycle of negative emotions and sexual dysfunction. 5. Avoidance of intimacy. Some individuals may avoid sexual activity altogether due to fear of failure or embarrassment, leading to further strain on relationships and decreased intimacy. 6. Impact on fertility. While ED itself does not typically affect fertility, it can make sexual intercourse difficult, potentially impacting a couple's ability to conceive if they are trying to conceive through natural means. 7. Underlying health conditions. In some cases, ED may be a sign of an underlying health condition such as cardiovascular disease, diabetes, or hormonal imbalances. Failure to address these underlying issues can lead to further health complications if left untreated. 8. Loss of quality of life. ED can significantly impact overall quality of life, affecting emotional, physical, and social well-being. It can lead to feelings of frustration, hopelessness, and isolation, especially if the condition remains untreated or unmanaged. It's essential for individuals experiencing ED to seek medical advice and treatment to address both the physical and psychological aspects of the condition. Treatment options are available that can help manage ED effectively and improve overall quality of life and well-being. To prevent erectile dysfunction, ED, individuals should focus on maintaining a healthy lifestyle, managing underlying health conditions, addressing mental health concerns, communicating with their partners, limiting medication side effects, practicing safe sex, and scheduling regular checkups with their healthcare provider. This includes eating a balanced diet, maintaining a healthy weight, avoiding smoking and excessive alcohol consumption, managing conditions such as diabetes and high blood pressure, practicing stress management techniques, and seeking support for mental health issues. Open and honest communication with one's partner is also important, as well as using condoms to protect against sexually transmitted infections. Additionally, individuals should discuss alternative medication options with their healthcare provider if they are experiencing ED as a side effect. By taking these proactive steps, individuals can reduce the risk of developing ED and promote overall sexual health and well-being. Diagnosing erectile dysfunction, ED, involves medical history taking, physical examination, and sometimes additional tests. The process includes the following steps. 1. Medical history. The doctor will ask about symptoms, sexual history, underlying health conditions, and medications that may contribute to ED. They will inquire about the frequency and severity of symptoms, recent life changes or stressors, and other relevant information. 2. Physical examination. This may include examination of the penis and testicles, assessment of blood pressure, and evaluation of physical signs related to cardiovascular health, hormonal imbalances, or neurological issues. 3. Blood tests. These may be ordered to check for underlying health conditions such as diabetes, high cholesterol, low testosterone levels, or hormonal imbalances. 4. Additional tests. Depending on the suspected cause of ED, additional tests such as duplex ultrasound, nocturnal penile tumescence (NPT) test, and psychological evaluation may be recommended. 5. Questionnaires. Patients may be asked to complete questionnaires or surveys designed to assess sexual function, satisfaction, and quality of life. Once a diagnosis is made, the doctor will work with the patient to develop an appropriate treatment plan tailored to their individual needs and underlying causes. Treatment options may include lifestyle changes, medications, psychotherapy, or medical procedures, depending on the specific factors contributing to ED. Open and honest communication with healthcare providers throughout the diagnostic process is important to ensure effective care.